Welcome everyone to today's session. Good afternoon to those on the Eastern time. Good morning to the rest of us. But most of all, welcome to today's webinar, where we'll be hearing from key federal partners on some insight on the requirements when utilizing cooperative contracts. We'll highlight some of our NASPO contracts and even the process of going about getting some of those federal approvals. Thank you all for spending your time with us today. We're glad you're here. Before we begin, I'd like to take a moment to explain today's format for the webinar. All attendees are muted. You can enter any comments or questions in the chat box, typically the bottom center of the Zoom interface. If you would like to ask our presenters any questions, you can type it in the Q&A box at the bottom of your window. Questions may be addressed during the presentation or during a Q&A session after the presentation, but please do, as you have your questions, feel free to interject those in amongst our NASPO team, and our federal partners who are joining us will be answering those throughout the webinar. As this webinar is being recorded, following the webinar, those who have registered will be sent a copy of the recording, just a URL of the screen recording, as well as some of the handouts, the presentation materials that we'll be going through today. With that being said, I'm very pleased to introduce our speakers today. We're honored to have with us Don Bartholomew, a management analyst with the Food and Nutrition Services within the the U.S. Department of Agriculture. Lisa Leonard, a federal analyst within the Children's Bureau within the U.S. Department of Health and Human Services. We have Nathan Bolima, a management analyst within the Food and Nutrition Services within the U.S. Department of Agriculture, and Nick Moser, a state systems coordinator within the agency administration for children and families within the U.S. Department of Health and Human Services. We're excited to have you with us. And so now I'll turn things over to you, Don.
Thank you so much, Solomon. I appreciate it. So to get us started, we just want to tell you what the topic at hand is. I think Solomon led into it, but it's getting to know some key federal oversight requirements when utilizing cooperative contracts. One thing I will say as well is we know that in the 2024 top 10 priorities, yes, I looked ahead for NASPO, there are a few that I think will be covered in this presentation. So, when you talk about modernizing the process, in some cases, it is also looking at the process at large and seeing where some of the roadblocks are. So hopefully through this presentation, by getting to know us, seeing where we fit, which we'll discuss when we talk about the agenda, that'll help you to understand and see where United States Department of Agriculture, Food and Nutrition Service, and the Health and Human Services offices fit in with that goal, and then also that customer service piece that I know is key. I know you have 10 out of the 10, that's only 8 that I spoke to. There probably are some others, but just wanted to speak to that at the onset of, shared goals and visions between NASPO and our agencies. So just kind of going through today's agenda, in order to reach our overarching goals of this presentation, we work to create an agenda that focused on kind of 4 key themes. One is identifying who we are, the United States Department of Agriculture, Food and Nutrition Service. Health and Human Services is also here, and they will be represented by folks that will cover the Children's Bureau, Office of Child Support Services, and the Centers for Medicaid and Medicare. And also how we fit, what we do as federal partners to provide federal oversight and technical assistance, and also the provisions of federal funding for information system projects. And I want to emphasize that because our agencies do not cover things such as like construction costs or resourcing outside of the context of an information system project for some key programs we'll cover later. And then there's key considerations for the procurements within an advanced planning document process. We kind of have 2 processes at hand that occur. One is related to the funding, which is this APD process, and the others are the procurements that are attached to those funding pieces. You may ask why we're going to cover both in today's presentation. Well, we hope to tell you, but there is key pieces of it that will apply to you through whether the NASPO procurements itself or as part of this organization, your role as a procurement officer within your state. So going forward here, let me explain a little bit more about who we are. Some of you already may know or have worked with the United States Department of Agriculture. We provide leadership on a variety of issues. I'm not going to get into everything, but let's just say the range is broad. We have rural development, which is covering things, as basic as housing needs and internet needs. And then we have our agency in office, which is working through the Food and Nutrition Service to look at 16 nutrition assistance programs, of which we will primarily focus on 3 through this presentation that have more of an emphasis on the process. So as you see here, our Supplemental Nutrition Assistance Program, commonly known as SNAP in most states, and you may see, SNAP participants or labels that, grocery stores or retailers may have saying they have the ability to allow SNAP beneficiaries to gain access to their benefits at stores. So trying to think of visibility again, if you only see the program a few times a year as they come to you about information projects where you might see them elsewhere. And then we have our new supplemental or sorry, special nutrition assistance program for women, infants, and children. And that's our WIC program, as you may see as well. And then our brand new baby and program, the summer EBT program, which is our 16th program and is starting out this summer. So I think, fortunately or unfortunately, I presume that many procurement officers, or maybe at least slightly aware of this program, since I know it is taking a lot of bandwidth, at least for our agency within USDA, but I think is covered, a lot nationally these days. And so while I'm not going to mention every organization specifically within USDA or even within the offices here, I'll just do a couple of things. One is just to clarify that the state systems office is an office that is attached to the national office, but functionally aligned with our regional offices. We provide the oversight, monitoring, and technical assistance for state systems in eligibility system projects. Again, we have no purview over procurements that are related to construction, staffing resources, or for non-eligibility systems. We, though, partner and work in conjunction with the regional offices to support program policy efforts. And then what I would say is that while I did not mention them, our regional offices do contribute as well to the oversight and review of procurements that you may be party to or contributing to as the procurement officer. And they look at the oversight and monitoring and technical assistance from the policy aspect for the 3 programs I have mentioned in the blue chart. The green chart is my fellow colleague, and he'll be talking about that soon. And then finally, just a little bit more about our office and state systems, where myself and my colleague Nathan Belima come from. It provides oversight of the state's systems or the advanced planning document process for FNS. In that capacity, we provide review of the process for the series of successive steps through which a state agency obtains federal prior approval and federal financial participation in automated system projects related to FNS programs. These include your systems for eligibility, determining who is eligible for the SNAP, WIC, and Summer EBT program, and also the electronic benefit transfers. So those like the ability for people to swipe cards, just as the rest of us do, when they are eligible for benefits for these programs at a store or retailer. That is also covered as contracts and information system projects that we work on. So I'm going to transition now, or rather transfer. See, I got stuck on that word, to my colleague, Nick Moser, who's going to cover the Health and Human Services components.
Thanks, Dawn. Good morning, good afternoon, everybody. So first, at a broad level, for those of you who aren't aware, the mission of the U.S. Department of Health and Human Services is to enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. That's really broad. And so today what we really want to do is we want to focus the discussion on the Centers for Medicare and Medicaid Services, Children's Bureau, and Office of Child Support Services, because these programs help fund information systems responsible for administering Medicaid, child welfare, and child support programs in states. When a state has an enterprise system across multiple programs, the state systems coordinator works with each of those offices for consolidated federal government support. On to the next slide, please, Don. Thank you. Now, in terms of how we fit, states, tribes, territories, and locals carry out the programs. The federal government approves, monitors, and certifies information technology projects that help administer these programs. So said another way, we look at state plans and their related procurements to ensure the American public would approve of their taxes supporting those endeavors. Now, we got to talk about the money. Very important. So the funding mechanism is based upon a match approach in which the federal government matches funds to state expenditures based upon varying percentages as depicted on the screen. The federal funding percentage ranges from 50% to 90%, depending upon the program supported by the endeavor. States can partner directly with a single federal entity to build an information system that supports that program. Or they can partner with several federal entities all at once to build an information system that supports multiple programs. There's considerable responsibility that rests with the state for operating welfare-related programs efficiently, effectively, and economically, and automated systems are needed to accomplish this task. And now back to you, Don.
So thank you, Nick, for that. And again, as Nick said, we know that a piece of it and component that is also very important to you as procurement officers is that value in the money and also figuring out how you can do it most efficiently and effectively. So kind of to tie into that is this funding document we alluded to a few times now in the presentation. State agencies are required to submit an advanced planning document, or APD. If you look at any of our handbooks, manuals, I think at the federal level, you'll constantly hear that term. It never goes away. To ensure that federal partners can review that document in order to ensure the state can receive prior approval or for any utilization of funds for information system projects supporting our WIC program, SNAP program, summer EBT programs, child support services programs, child welfare programs, and centers of Medicaid and Medicare programs. So the APD starts with the planning documents and evolves to include the implementation documents as well. These documents are artifacts that could include a project plan, a schedule, a budget, a cost allocation, the management plan, functional requirements, risk plans, and many more. The APD mirrors what is expected for carrying out any major information system project or enhancements as well that follow the system development lifecycle. An APD explains the state agency's intended goals or activities for the project expenditures and also the planning and implementation efforts and costs that go along with it in advance of carrying out or incurring costs. And that's going to be a key theme as well. We really need to ensure that we have knowledge of the procurements that you want to enact in advance of you incurring costs utilizing them. So APDs describe the broader terms for the state's plan for managing the design, development, and implementation and operation of a system that meets federal, state, and the user's needs for efficient, effective, and economical manner of handling those efforts. So establishing a system and a program performance goals in terms of projected costs, benefits, and securing federal financial participation for the state and or tribe is really important. Explaining to the state agency's intended activities and projected expenditures for the planning and implementation of the information system in carrying out that particular work and expense is really important as well. And a point I'd emphasize is as party to that, if you haven't heard already from our key partners in the program offices that work with you and partner at the state level as a procurement officer, I hope you will soon, because I can say they have active projects upon which they have multiple procurements that they are advising us of. So I hope you're getting the same notification. And one goal too, I would share, and we'll share this again later, is the importance of, for example, if you're standing up a NASPO procurement, connecting with your state offices, because they might have shared goals of having some work performed, and there may be ways you see this contract model as most effective. But if they don't know that this option is available or they're planning without including you at the onset, you may not be able to reach these shared goals that could be, in effect, more beneficial for your organization. So the APD process is the process by which these documents are submitted for federal review, approval, and funding. It begins the period of communication and cooperation oversight that'll last till the project is complete. I must admit, I can't speak for HHS, but I feel like a lot of projects lately have not yet reached a full completion status because there are so many great ideas at the state level to enhance those systems. So we might roll out of one system project and go right into the next with a new document. Documents also will be submitted throughout the project and include planning, procurement, and status updates. The federal partners provide these reviews in accordance with the regulations, and we also may require revisions or clarifications before approving. State agencies cannot, and I know we've said this already, obligate funds or execute contracts without federal approval if they reach our thresholds. So just want to be clear about that. So advanced planning document types, while we're happy to cover the details in a separate session, at this time it's just enough to know, so I don't want to scare you with this slide, that there are multiple APD types and that there's a requirement that they be submitted throughout the system development lifecycle process. These documents outline the state, tribal organizations, or local government's plans for a system project, inclusive of the procurement process, and the procurements planned throughout the duration of that project. So again, really important for all entities to be connecting and communicating here. So now I'm going to transition to Nick. Do you want to take it away?
Thanks, Don. I appreciate it. So this slide emphasizes that the federal government gets 60 days to review both APDs, the planning documents that we were talking about, and procurement documents. While there are slight nuances between how each of our respective agencies, USDA and Health and Human Services, calculate the 60 days, what's really important for you, especially as you're going through these procurement efforts, is to account for our federal review and approval as you're putting together your project plans and schedules. The last thing we want to do is for the federal approval process to be a burden and to interfere with your goals and outcomes. And so that's why that proper planning leading into this whole procurement endeavor is really going to help for a smooth project. We can go to the next one, Don. Thank you. So the regulations listed on the slide explain, back up a little bit. There we go. The regulations listed on the slide explain what's required for securing federal funding for information systems funded by U.S. Department of Health and Human Services. For specifics, I encourage you to review these regulations yourselves. And at a high level, just understand that state plans are submitted annually for federal review, and funding is authorized for 1 or 2 years. In general, associated procurements are also reviewed as they occur through the software development lifecycle. Changes to schedules, budgets, and scope of project plans also are sent to the federal government. Centers for Medicare and Medicaid Services, Children's Bureau, and Office of Child Support Services each have their own regulations and guidance. And if you wish to learn more, we'd be happy to connect you with the appropriate staff to guide you through their requirements. And Dawn, back to you.
And thank you, Nick, and thanks for graciously managing that. I don't know why the sides glitched, but thank you for the patience of the audience too. So we're not going to have much time to go through all of the procurements referenced here, but just know that each of the 3 programs, the SNAP, WIC, and Summer EBT programs at the United States Department of Agriculture, Food and Nutrition Service have an advanced planning document process and procurement requirements that must be followed when federal financial participation is utilized. One I am going to emphasize here, or 2 things I would reference, is 1, we have an FNS handbook. We will be sharing the slides after this, and ideally the links that you receive in those PowerPoint presentations should work and send you to some of the resources. So 2 things I would call out on this slide is, again, the Food and Nutrition Service Handbook 901. This is our information system guide or handbook. We have an entire chapter on procurement in chapter 4. And just a quick note, while that link will still work, we are planning an update, a 2.5 version that should be out in the next month. So just would flag that too. Our 2 CFR 200 Appendix 2 is another source that I would strongly encourage all parties to go to. There are very specific ones for each of the programs, as you see here, that are more nuanced to regs that might be in addition to the other federal procurement legs that apply. And these include procurement requirements for contracts utilizing federal funds, and it's something that's consistently used for all of our programs.
Mhm.
So going forward, okay. Many of the implementation projects involve procuring contracted services, equipment, and software, or all of these. There are costs of the procurements that are part of the total projected cost used for determining when an APD is required, and a procurement is needed. The RFP and the contract resulting from that RFP, I want to emphasize, must be submitted for federal review and approval prior to the issuance of that RFP or posting to a site, or the execution of the contract or an amendment when they exceed the federal thresholds. And states may submit requests for proposals simultaneously with their advanced planning document processes. States must ensure that the draft contracts are provided prior to their release dates, and then any changes or amendments, if the RFP is posted and out on the street, are provided to the federal agencies. Regardless, if it's an HHS project or an FNS project under USDA. Changes also like amendments to existing contracts may also be needed for federal review and approval. And like in advanced planning document, this is based on the potential dollar value of the contract or the amendment. So while related to the APD thresholds, there is a need for a separate threshold requirement for the federal review of RFPs and contracts. So make sure that you understand that difference and distinction. So while you probably will not lead the APD process, submission process, or efforts, there is a whole process that likely you will be heavily party to related to the procurements. And because, as we said, the advanced planning documents include references to the procurements and said milestones, there's still a piece for you or team members in your team in that process as well. And then the procurements are subject to federal review, generally include system development projects, transfer and implementation projects, sometimes for our WIC program, a shout out to them, management information systems, because they have their own nuanced term for what is an IS project. And then electronic benefit transfer system projects, again, the swipe card at APT, modernization planning, software systems, software integrator work, project management work, quality assurance work, or independent verification and validation work. These are just some. We know there's more, but we're just trying to highlight a few that whether it's a NASPO procurement or a statewide master agreement procurement or a specific procurement for that program, that would likely be covered.
Hey, Don, we have one question in the
Sure.
chat regarding the upcoming 2 CFR 200 threshold changes taking effect in October of 2024. The question is, will these thresholds have any impact on renewal periods in existing contracts?
So on renewal periods. So in that capacity, renewal periods. I think offhand, we'll have to probably take that one offline because I'm not exactly certain when you talk about the renewal periods, are you talking about the performance period? Maybe if there could be a little more clarity given by the individual who proposed the question on the, is it a threshold question about for example, we've aligned our WIC program with the simplified acquisition thresholds, so it's 250,000 right now, but we know those are ever increasing. I don't know if we'll align in the short term with other changes or what exactly it is, because the 2 CFR 200, a lot of those references do apply to at least all of the FNS-based programs, but in that capacity, I would say that the programs still have, in some cases like SNAP and Summer, they have their own threshold requirements for at least the pricing piece, and the emphasis on fair and open competition would still apply. And within that capacity, I'm not certain that all of the regulations of 2 CFR 200 would apply if there's something related as nuanced as performance, because I haven't seen any as of yet that have referenced our programs directly. However, that said, there could be changes that would apply. So if there's any ability of that party to share a little bit more, or to put in the chat the Q&A, if we can't get back to it today, we certainly will in some other capacity, whether by email or follow-up. But if you can share a little more, that would be appreciated, and maybe either we can answer on this call or separately. Yep. Hello? Nate, are you still there? Go ahead. Sorry, go ahead.
I think Nate may have frozen. Perhaps what I'll do is I'm just going to continue presenting, and if we have additional follow-up questions, follow-ups, Nate and the partners behind the scenes can capture those, and keep interrupting us, please. We love it. Okay, so federal procurement oversight. Approvals for procurement, such as RFPs, contracts, and contract amendments, don't approve the funding, as we've mentioned previously. What they do approve, it's the scope, schedules, terms, cost, etc. The approval to expend the funding to support those procurements comes from the advanced planning document. The work and estimates for the procurements must be reflected in the advanced planning document, and prior approval is required before executing any contracts or contract amendments. And Dawn, back to you for some specific technical assistance about cooperative purchasing.
Sure, thank you. I appreciate that, Nick. And we will get back to that question. I promise, even if it's not in today's meeting, we will absolutely get back to it. So for procurements, such as the NASPO or statewide procurements, the following additional procurement guidance should be considered. So the meat of why you're here today, right? Jokes aside, I'm sure you wanted to learn more about the basis, but to utilize a statewide or NASPO procurement developed within your state, or with other states through this cooperative arrangement, you must ensure that free and open competition is honored. So while that is a requirement for all contracts exceeding the applicable federal procurement thresholds, it becomes even more important or essential for these cooperative purchasing arrangements where multiple states or within a state, multiple programs are procuring together. You may be asking what competition looks like in these instances. It should be an evaluation of the potential bidders at 2 levels. So you have that right now in a lot of your NASPO procurements, but we want to make sure it's being followed. At times we have states that say, well, I completed all of the efforts as part of the broader NASPO procurement. There was a lead state. I indicated I was part of that procurement. I helped with the evaluation. And now when it comes to the tier 2 evaluation that is listed in your instructions, you may say to us, or your vendor may encourage you, to come to us and say, well, we're ready to decide on our tier 2 award. And then we'll ask you, well, first off, we should have seen that statement of work for that tier 2 submission, and also all of the documentation that we look at as background related to your tier 1 award, but also, did you evaluate and provide a request for quotes a lot of the times through these NASPO procurements, or even on a statewide level, that were required. So if it says you're supposed to have at least 2 quotes to be able to award, we're going to ask you, did you get 2 quotes? We might not need the nuances and details of those particular quotes, but we need to know that that occurred and you had the competitive process at both rounds of review. That did happen recently with a conversation that one of the federal partners on this call had with the state. And unfortunately, in that case, because they had not done the second round, we were not able to support it. But in other cases, we have been. And that's why it's important to communicate with us early. And when I say support it, and other cases we have been, I want to caveat because the state followed the requirements of the procurement, procuring and having an evaluation mechanism at the first tier of award and at the second tier of award, meaning at their state level related to that NASPO procurement. So ensuring the lead state also in the RFP has terms and conditions that align with our programs, and ensuring that any participating addendums that you have, the statements of work, or any other associated document are shared with us when that procurement is being requested to be utilized for services that apply to our programs and their information system projects. These procurements, again, could be, if they're part of the information system and over certain thresholds, subject to our prior federal review and approval. So it's important to share these links where these materials live, providing the federal partners with the evaluation methodology so we can see it meets our requirements of free and open competition. You know, recently we had a state share procurement that they were working with cloud services, or they wanted to work with the NASPO under the NASPO Cloud Services Value Point procurement. And having the information I just mentioned was really the way that I could and my colleagues could at the FNS USDA ensure that they had followed the first tier procurement, being a participating state, having a participating addendum onto the lead state's procurement, in that case, Utah, and then also ensuring through that participating addendum, because there was a conflicting cause with the lead state's procurement, in this case, the federal license, that they were able to update and amend their own participating addendum and the statement of work that was under it to ensure that the vendor they procured with was going to be able to align with the required federal clauses for our program. So honestly, there's two ways to deal with that in the future. Either one would be, if you can, at the start of the initial tier 1 award, include some of our terms and conditions as another appendices in your large order of precedent options, and you could put it as an optional terms and conditions when these programs are included or something like that. It would streamline that, but if you can't, just ensuring that at the second tier level you are able to include a higher level order within the participating addendum for the addition or subtraction of terms and conditions that either may not be applicable or may be in conflict with the federal requirements. So that's a key piece too that I would reference here. And then I'm going to jump to our federal procurement requirements at USDA FNS and some of the thresholds you may be wondering that apply to these particular procurements. So for information system projects, if you have an acquisition for the SNAP or the summer EBT program that is over $6 million, and that's the holistic cost. We get a lot of questions by states about, well, is it just the share that's the federal share, or is it just the part that's applicable to SNAP or summer EBT? Oh no, it's the part that's applicable to all programs. So if you have multiple programs involved in that particular contract, we care about that total value. We understand that, and we do want to know what the portion is of share that we have, but we need to know what that total value is, and that's the threshold we look at to say you're over that value and therefore you're required to submit that particular contract for review and approval. For non-competitive, it's substantially lower for the food nutrition service. It's $1 million. These are for the SNAP and the summer programs, the EBT program. For the WIC program, it's different. As you see here, it's $250,000. So it is much lower a threshold, but the review requirements are different. And the updates to the handbook that I plugged earlier for Handbook 901 will further explain those differences for the WIC program as we modernize that tool. So for FNS, we also expect that advanced planning documents include all relevant information about the planned acquisitions in order to justify the funding. And these thresholds only apply to the request for proposals or contract requests, not the prior funding approval.
Thanks, Don. So as Don just mentioned, you know, the federal government, we're huge advocates and proponents of competition. And so what you just saw on the FNS side of the house, it is mirrored in the HHS side of the house when it comes to the thresholds. If it's a competitive procurement process, then it's a higher threshold. If it's non-competitive, it's a lower threshold that requires the federal review and approval. One of the things you'll also notice on this slide is that when it comes to those, and you can really think about it, when it comes to those smaller procurements, we don't want to burden states with sending in everything. That's why these thresholds exist. We do want to be aware, and so we ask that they're included in state plans so that we know what the funding is for. But again, we don't want to be a burden. And I think I'm ready for the next slide, Don.
Okay, just bear
So,
with me here.
yeah,
I
no
am
worries.
clicking it.
No
I don't know
worries.
why. It's just slow. I do apologize for the lag, folks.
Beautiful. Okay.
Okay.
So on this slide, we've alluded to some of the procurement clauses already, or in previous slides. In general, the federally required procurement clauses address concepts such as federal license and state ownership of federally funded IT, equal opportunity, termination for cause and convenience, etc. And on to you, Don. I think you're up now.
Sure. So, let me see here. Again, sorry with the lag. Okay, here we go. Look, apparently the computer likes me sometimes today. So when it comes to the standard procurement requirements, we assume as procurement officers, whether it's you individually or the teams, if you're lucky enough to have the resources within your entity to have more people, which we hope for you do, because we know you just don't cover our programs. The standard procurement requirements may be, something you're very familiar with, but we still felt it could be valuable to just emphasize and put up the slide here some of the ones that we look at, and when we don't see them, we would call out to you for your attention to just say it would be beneficial for you to clarify what's in and out of scope, for an example, or who what clauses could require the contract to be terminated, or now after we've had this awful pandemic for quite a few years that now is finally seeming to come to a close, that you include some provisions that clarify, force majeure or other things, which force majeure I know was utilized a lot, but other clauses too that specify like what would happen in those scenarios, what happens to the contract and the work. Also in scenarios where funding may not be available, how does that happen? How do you utilize it? So just basic things like that. Again, these slides will be shared so you could look at them in a more nuanced way later, but these are just some key ones we look for. And then in addition to that, we have these additional United States Department of Agricultural federal regulations and procurement clauses. I'm not going to go through every single one today, but I will emphasize a few that are on this slide just for awareness. I know some that come up and sometimes are in conflicts with what states would do at a smaller simplified threshold or do for more nuanced procurements in their states are like 2 CFR 200-319, which is the geographic preference requirements of prohibition. We also have some programs that have similar prohibition requirements within their program, but that's the one that applies to all three of the FNS related programs. These, involved clarifying that while you could require a vendor to be licensed within your state, you can't specify the area and say, I only want people that live, within, and I'm not calling out Ohio, but Cincinnati, Ohio, let's just say, and work there, that's the only people who can apply. If that's a mandatory clause, that would be in violation of the free and open competition requirements according to this provision. And then when it comes to 2 CFR 400.2, we have this conflict of interest clause. Where we see it come up a lot is as part of the state projects for information systems. A lot of the times you may be considering procuring independent validation or verification, or your state and law may require it. States tend to get into a bit of a confusing state with us if they have confusion over where the managerial oversight of that procurement lies. So sometimes we have a state say they're working with their SNAP program and they want to procure independent validation and verification for a integrated system project. If SNAP is one of the lead agencies in that system project, the SNAP procurement office can't be the one that has oversight of that procurement, because what it does is then they're not managerially independent. That means that they can go to IVNV, not saying you ever would, And whether it's the procurement office or a program office could have undue influence over their work. Independent is a really key piece of that. That is different than quality assurance, where they may be involved in the day-to-day work and they may be providing more than just observations and actually providing guidance and getting involved in that process. So that's another one I just wanted to mention that I thought was kind of notable in comparison to some of the others, while valuable, do not have to be as parsed through today.
This slide lists HHS procurement regulations with their links, so we encourage you to peruse them individually. At a high level, you can see the types of HHS procurement regulations, and you'll notice a lot of overlap with food and nutrition services. Software ownership rights, federal access to systems and records, and the prior approval conditions are commonly brought up in the context of a federal review. And back to you, Dawn, for the review table.
Sure. Okay. So this federal review table that Nick alluded to, it talks about, or it gives a sample of what a perfect scenario would be for information system projects that we cover. And I really do mean perfect, because I'll be honest, in my years of working with the agency and working with, well, if you count the programs I work with, it's like 15 to 20 programs at any given time, offices within states. Those particular entities have yet to meet this standard. Some have come close, but many have not. And it's not from any choice on their own, it's just how the process works. So while this is a sample of the federal procurement and review process, just to get an idea of what some of those milestones are, you'll note that if everything goes well, it's taking up to 34 months, almost 3 years from start to project start to project finish or completion. This assumes that there's no mistakes made and there's no delays in milestones, that there's no second round reviews, there's no pandemics, hardy har har. Hopefully it's okay to start joking about that a bit at the federal or state level. So it really is like the perfect process, which we know does not always happen. But just to give you an idea of the types of steps really that occur and the types of timelines that are tied to those steps for one round of review. So these final tips and takeaways, and we do see there are some questions, so I'll be sure to get to those, as will Nick, are really focused on different things. So we want to ensure that you connect with your state peers early in the procurement process and ensure that the project leads are aware of their available options when it comes to procurements, whether it's the NASPO procurement, statewide procurements, individual state procurements. What are those options? As we shared, there are times where, if HHS is, say, or FNS is not involved early enough in the process, you may not be able to utilize those procurements, unfortunately. We had an example actually with NASPO that was like this, where there is a procurement that is available under NASPO for health and human services, which sounds then like, right, it would apply to all health and human services. But no, it was specifically for Medicaid and the Medicaid program and trying to ensure it could support a management information system for that program or an information system, and not for broader programs such as child welfare or child support. And at the time, the entity had come to our federal partner and said, well, I'm in child welfare. Can I utilize this for a new system project, an information system? And the answer was no, because that scope of work did not apply. So in the future, if in that particular case, you want to utilize and work as partner states to utilize the NASPO procurement, and it's scope specific to a specific, program entity, and you assume you're talking to the umbrella, it will be very important to ensure that you're also working with the other program offices within that umbrella or department to ensure that they're also on board with the procurement that is planned and is going to be posted for vendor support or requests for vendor support, I should say, through bids. So I just want to emphasize that point. Also being clear with all parties on any changes or limitations in the term, cost, and scope of the procurement. fairly recently, it was around 2019, I had a state come to me about an ASPO procurement for staffing resources that they wanted to use. Well, there was a problem. The procurement was about to expire. So looking at those performance period dates. So if your procurement that you want to have and you're like, you know what, my state's party to NASPO, we have a procurement we want to utilize, but it's expiring tomorrow, it's unlikely we can support you in utilizing that procurement unless, you know, say if it was expiring in 8 months, even if you were at the end of it, and there was instructions though that said that, you know, while the procurement expires in 8 months, if someone procures within that 8 months, then they can have up to X time, say like 5 years, then you might have enough time and length on your, you know, potential award to be able to justify still using that procurement. But if it says hard stop, now the staffing resource contract closes, once that lead state's procurement ends, all options ends, then no, you cannot utilize that procurement. So it's really important to keep in mind, you know, kind of like we always talk about, and you probably talk about in your offices, that triangle: cost, time, scope. So also broader themes, you know, we want to just talk about communication. We've said this like 1,000 times. We know it was one of your points of points of emphasis for 2024 for your own organization here. Communication with the stakeholders, with the partners is important. Early and often communication to your external and internal partners, making sure that the procurement office is really a key player at the onset of these projects rather than an afterthought. And ensuring that your stakeholders are having you participate in these discussions on the procurement and the project's development. We commonly hear, I'll be honest, and I hate to say it in this setting, but that the program offices or the IT offices will say they haven't touched base with you yet, or in a while, or they'll say it's hard to reach you, or you're the reason why they didn't meet certain requirements. We know it's a two-way street. We know that's only part of the story, but I would say getting and ensuring you're part of that initial planning stage, that you're still like looped in so that you're not the last office that they speak to when they're rushing to meet a deadline and meet certain funding requirements, is key. And also being realistic with them. I know it's hard sometimes to say to the organizations within your entity or even to us as federal partners that, you know, your times, while you had them well-meaning and thought they'd align, are not going to align. A pandemic happened, something else happened. The process that you had outlined for the procurement is now off. We need to know those as early as possible, and your teams need to know that as early as possible. So that transparency is key. And I would mention that here today. I know there's a few questions in the chat. I don't know if Nick, you want to me to transition to you, or we should cover those.
Let's dive into them now.
Okay, so just a few things. There was a great question about crosswalk with the thresholds, and I think this is the one Nate was talking about, and there was some great follow-up here related to the Office of Budget and Management making some changes to the single audit thresholds. So I know that there are changes planned. I do not assume at this point it will affect any of our programs. At some point, like I mentioned with the simplified acquisition threshold, the WIC program, we did align it with now many moons ago, because I know 750,000 has been out there for a little while. I don't know if that would change at any point in time. Right now it's not. So I wouldn't say, oh, in this presentation, it was said that maybe at some point we would. But with the other programs, those thresholds currently are pretty hard set. I'm not saying there'll never be changes, but usually the changes are brought on by statutory changes, you know, through acts of Congress, regulatory changes due to assessment of like the portfolio and really where the contracting is on average, and things like that. So I can't necessarily say at this point I see a change in some just because there's a change in 2 CFR 200 at this juncture. Related to that threshold piece. I don't know, Nick, if there's anything you want to raise on that or share, but it is a good question, and we can certainly follow up further if we hear of anything else.
Yeah, there's nothing more I can add right now.
Okay. And then someone also dittoed the idea that they support the idea that that agencies really struggle with procurement timelines. They had one office that it took 5 years for the length of the contract for the professional and technical contract. What term lengths do you typically see from other states? So it depends. One thing I would really say and emphasize is we have some states that when they get to maintenance and operation, they try to do 1 year like contracts where they have a 1 year option and then they take another 1 year option. It doesn't usually work well. By the time they try to complete all the paperwork, they're already into the next optional period and then having to make the same decision and also not then being able to plan for the next RFP to competitively procure services. So typically what we see is like a 5 to 7 year term and then like a 2 year option is typical. I know some states now are going to other models. They're trying software as a service for a variety of efforts, or they're trying to do, Cox solutions have been around for a while, but they're trying other methods, not always, doing all the work in-house or doing it through a memorandum of understanding between IT offices. And in those capacities, though, generally, I've typically seen, I don't know, I know Nate's on from my team, so you could either put in the chat or get on mic if you've seen something different, but that's what I've seen as the contracting timeframes. Nick, what have you seen at HHS or Lisa?
It runs the gamut. Yeah. But I thought that was well said. I do reinforce what you're describing in terms of I've seen the 1 year contract with exercising option years year after that, and that can be a challenge on the state end. Lisa, do you have anything that you wish to add?
I mean, it really does vary. I mean, I don't know that I have seen a norm amount of years. Different states have different procurement rules regarding that. But I do agree also with Dawn about the 1 year option years. That does become kind of cumbersome and difficult, but there really isn't, I don't see a norm or even 5 years is typically in that range, but I've seen some as long as 10, so it depends.
Same with me. I think with operation and maintenance contracts for information systems, a 5 year base contract is nice to see, and then having option years after that. Typically, I've seen 5 option years after a base 5. So
I think that covers all of the initial questions that we had in the chat, and our final slide is a wrap-up slide. So I'm going to speak very slowly, just kidding, to give us an opportunity, and everyone really an opportunity to ask any questions that have come up throughout this process. In general, we are super excited and thrilled about this growing partnership with NASPO, and we are here to be a support, and we look forward to engaging in further discussions to provide additional technical assistance and to make these cooperative purchasing procurements more accessible to states and tribal organizations that you guys all partner with. And Solomon, I see you have your hand raised.
Yes, thank you, Nick, Don, and Nathan, and Lisa for what you shared here. I've got a question on somewhat related to performance periods, but just looking at the overall use of a cooperative contract, specifically in, say, the software context. Have you run into any issues or constraints whereby an agency is looking to use federal funding to support, say, a software solution, and the service agreement that agency signs with the contract provider extends beyond the term, let's say the NASPO contract term? And if that extends beyond it, does that create an issue as far as federal funding is concerned?
So from my perspective, and please others from the federal side jump in here, I think it would depend on a few things. The key thing would be understanding what those instructions are and how it aligns, whether at the NASPO level or at a statewide master agreement. Where I've seen it becomes an issue is if, like I gave the example earlier, a state is trying to utilize that particular procurement, but there's not life left to that procurement, and the instructions do not provide clarity that a state can go out X years. And if it does have a maximum of X years and say 5 years out, then the contract should close by the 5 year mark if they were granted, say they issued the contract in the last year of the service. and it's from the state level statement of work, or however the state wants to call it, off of the NASPO award, is starting this year. Well, would have 5 years from this year, so it'd be 2029. It would expire if the instructions in the NASPO award, in the Tier 1 award, allowed for that kind of mechanism. If it said, you know, let me use cloud services, for example, and I don't know if this was a clause in cloud services, I'm just saying it. If Utah had in their contract that when the cloud services contract expires in 2026, that all performance periods will terminate at the same coterminous deadline, then we could not allow a state to go further, at least not under the competitive mechanism, which would make it then harder for a state to justify the non-competitive use potentially, because the reality is, if it's very clear in that initial procurement, we'll say, well, the competitive procurement was for X. In this case, the competitive procurement was for the life of the procurement up to, let's say, 6/30/2026, and it cannot go further. If the instruction said that as long as the award is made prior to 6/30/2026, that it can go forward for another 5 years, then the state potentially could have another 5 years. But could they go beyond that? Likely not, because then what are the, you know, terms and conditions that they're bound by? If there's no ability for them to do that because the procurement is no longer in existence, it would be hard to justify. At least that's the FNS opinion on it. Nate, feel free to elaborate the FNS opinion, and then others from the HHS side, feel free to jump in on that one.
I have nothing to add, Don. Thank you.
No, that's helpful. Thank you. Thank you for sharing that, Don. And I know we're running up right at the top of the hour, and I know that there is another question as far as recapping the Tier 1, Tier 2 of the procurement process. One piece as far as this overall webinar is concerned, this is definitely not the end of the conversation leading up to putting on today's webinar. We fully intend this to be a multi-part webinar series, but really looking to understand some of the intricacies that from you all, from our audience, is you support your agencies. You've talked about different timelines and how to best support your agencies through that process. But we'd love to hear from you. What questions do you have? What you would love to see as far as a future webinar is concerned. The structure for today's webinar was more or less high level. That was intentional there. But talking about future webinars and what would you like to see maybe in a bit more detail, in recognizing that we're just right to the top of the hour. I do acknowledge the question that you submitted in, Danny. We'll provide follow-up following to today's webinar on that topic there. But as we close out today's session, I want to thank our presenters, Don with FNS, Nathan with FNS as well, Lisa and Nick with HHS. Thank you for the time and information that you've shared with us here today. And thank you all for attending today's webinar and spending your time here with us. Again, as noted, we will be sending a copy of today's webinar, a link to the recording, the slides, as well as supplemental materials is part of the complete package that will be sent to those who have registered for the webinar. By virtue of joining, you should have registered. I will be sending it to those email addresses there. If for whatever reason you do not receive the materials like you were hoping, as I pause here, I'll post my contact in the chat as well. And you're welcome to send any of that direct outreach to myself, and we'll send you the materials here. That being said, thanks again for joining today, and just keep an eye out on future communications and webinars that we'll be hosting with our federal partners at FNS, HHS, and or other webinars to come. But thank you all for joining.
Thank you.
Thank you.